Well, I'm going to go beyond in a few minutes, start having a chat with my guest, Dr. Sacchetti from York, Maine. So keep it right here.
If you received our recent appeal letter in the mail and haven't donated yet, we hope you'll consider doing it today. We make very good use of every dollar you send our way in the service of connecting and promoting community here in the Seacoast area. If you can't find it, just visit WSCA032517 and click Become a Member today. Thanks. Please note, the opinions expressed on this show are of the individuals who speak them, and not necessarily of Portsmouth Community Radio, its members, or Board of Trustees.
All right, it's 11:02 at WSCA, Portsmouth Community Radio. Good morning, Dr. Sacchetti.
Good morning, John Supersport.
Thanks for... Well, I'm going to go beyond in a few minutes, start having a chat with my guest, Dr. Sacchetti from York, Maine. So keep it right here.
If you received our recent appeal letter in the mail and haven't donated yet, we hope you'll consider doing it today. We make very good use of every dollar you send our way in the service of connecting and promoting community here in the Seacoast area. If you can't find it, just visit WSCAFM.org and click Become a Member today. Thanks. Please note, the opinions expressed on this show are of the individuals who speak them, and not necessarily of Portsmouth Community Radio, its members, or Board of Trustees.
All right, it's 11:02 at WSCA, Portsmouth Community Radio. Good morning, Dr. Sacchetti.
Good morning, John Supersport.
Thanks for coming by.
It's my pleasure.
What timing I have after yesterday's...
Impeccable.
It's like, wow. Last night, I'm doing some prep work for the show and also for your visit, and nonstop on the TV is all about the healthcare bill. It's like, wow, what timing
Well, you can't turn
have.
the TV on without hearing about healthcare.
Or the Russians.
Yeah.
It's like, wow, can I just get like what's going on locally? All right. Well, Dr. Sacchetti has a practice in York, Maine. As most of you know, I live in York, Maine, so I do know of him. I know him. And so I thought it'd be interesting to bring him on the show and talk about something that's kind of, well, in this area anyway, kind of new, called direct primary care. Maybe we'll talk a little bit about what is it, what it's not. And Dr. Sacchetti owns a practice in York, Maine. So without further ado, I will open it up and let Dr. Sacchetti tell us a little bit about himself, and then we'll take it from there.
Well, John, I've been practicing in the local area for about 10 years now, and I'm an internal medicine doctor by training. I did my training in Massachusetts, went to school at University of Vermont in Burlington, I've been practicing in York and York County for about 10 years. I decided to sort of break away from the usual hospital-employed physician model, and I did that about a year and a half ago. And I didn't really know at the time, but what I was pursuing was this thing called direct primary care, where doctors just contract directly with patients. There's no third-party involvement. And
now, by third party, you mean medical insurance, stuff like that?
Correct. Yeah. It's really kind of getting back to the basics. And what you find is when you start to simplify that relationship, patients get, longer visits. They feel like the care is superior. There's been studies that show you decrease hospitalizations. Actually, there are other studies that show, and patients actually realize this, some of them in my practice realize this, that even though they're paying me, we're actually decreasing their overall health expenditure.
Right. So, coming from Boston, I started hearing a little bit about this, although down there it was a lot different because they were calling them concierge. And we could talk about that difference because there are a lot of my friends, when I talk to them about having you on and what you do, and of course the first thing they say is, "Oh yeah, we have them in Boston. They're called concierge."
Yeah, right.
And there is a difference. We could talk about that difference too. But one of the things that I know everybody seems to be frustrated with, and this seems to be a part of the solution, which is what I like, is you have an appointment with your doctor, who's usually run out of a hospital, has his own practice, but tied to a hospital, and you get in there. And, of course, it took you 2 months to get in there because you couldn't get an appointment. So you finally get in there, and I'm seeing this getting worse and worse. And that's why I like having you on, because you're local and you're in this community, so you can appreciate what I'm talking about.
Right.
I'm used to Mass General, Brigham and Women's, and all those hospitals. I come up here, and, of course, we have the locals up here.
Mm-hmm.
But it's a different ball game, I find. You don't have 1,000 doctors surrounding you like we do down in the Boston area. So what I find happens is you need an appointment. So, I don't feel good. I'd really like to get in today. Well, the first opening he has is in 3 weeks. And, you hassle on the phone, and if you're lucky, you get on a waiting list for maybe 2 weeks from now.
Sure.
Of course, by the time you see the doctor, you feel better. But what's frustrating besides that to me, and I don't know if you could talk about this a little bit more, but why must I see 4 people when I have an appointment before I actually get to the doctor, who then sees me for like 10 seconds, but he's already been prepped by the other 3 people? So,
right.
And doesn't that add the cost to the medical?
Oh, for sure. For sure. There's actual statistics that show, for every, dollar spent in the on a Obamacare plan goes toward administrative costs. About 50% goes towards administrative costs, and when you look at Medicare, about a third of every dollar goes towards administrative costs. So there's a lot of administrative costs just built in.
What an overhead!
Yeah, it's huge. It's huge. And so in direct primary care, we have very low overhead, and you get rid of the superfluous things, a person's not going to see 3 other people before they see the doctor. And when I say superfluous things, it also eliminates a lot of the nonsensical questions, the repetitiveness. Yeah.
That drives me crazy. I hear the same question by all 4 individuals. And I'm like, didn't you talk to the other 3?
Yeah, there's too much redundancy. And direct primary care, we get rid of a lot of that. Patients, they have an appointment, and generally speaking, we because we're in charge of our schedules, we can allow X amount of time for the patient. I know somebody who's complicated versus somebody who's not.
Right.
And doctors nowadays are just not in charge of their schedules. Hospital practices are businesses. They're run like businesses.
Well, I also find, too, that over the last few years that individual doctors, and I know it's not their fault, and I actually see this even in the big Boston hospitals, you can't really step aside from the medical discussion for a second to say, how's it going? They're very focused. You can see it on getting to the point and leaving the room. And me as a patient who knows, especially in today's world, I have to dish out $6,000 up front before an insurance company ever kicks in. You can't spend 1 minute with me to hear anything else about me except for, my particular situation of why I went to see you. Unlike, and I purposely want to go here because reading about what you do and that practice of direct care reminds me of back in maybe when I was in my teens and even younger, we had family doctors. And you could go into the family doctor. There was no rush. Sometimes he spent more time with me than I wanted. But, they would follow your health care, every step of your health care. They would make home visits, and sometimes they would even issue medication from their own hospital, so you didn't have to go to, some chain of drugstore to go wait in line to go get it there. Mm-hmm. Correct me if I'm wrong, but doing some research on this, what I was reading was, to me, sounds like we're going, using today's technology though, but we're going back to the good old days of I'll call it value added for a doctor. Mm-hmm. where he's not just saying, okay, you have a cold, you need to go to Rite Aid, go here. I want to have a chest X-ray, go here. Because to me, doctors today become more of the navigator. They're like the nucleus, and they're pointing to everybody else.
Well, yeah, sure. At least the primary care doctor acts like the hub of the wheel, so to speak.
If he even gets to see you.
Yes, you bring up a lot of good points. And one of the things I would just, address one thing, just in terms of the sort of, splintered care. Doctors nowadays have to have their own agendas. I mean, and patients certainly have their, list of problems that they want to share. And so the two things don't always coincide. And the average primary care doctor like myself, who's in the system, I'm not speaking about direct primary care, I'm speaking about a doctor who is in the current system, spends somewhere between 7 to 8 minutes with the patient. So it's almost impossible for the patient to sort of get
right.
across what they need. And so when faced with that situation, the doctor's usually going to win out, and sort of impose that agenda. Even if the patient's there for, let's say, a diabetic checkup, but they have a problem with a cough, it's like, well, no, you got to stick to the plan. The plan book says we have to talk about your diabetes.
Yeah, I know you have a dead battery and a flat tire, but you came for the flat tire, so figure out a way to start your car.
Yeah.
I had read last night, I did my homework,
All right.
that the average doctor, and this was kind of not a shocker to me, but I don't know if everybody actually really thought about it. The average doctor really spends 6 to 7 minutes with a patient that's in the healthcare industry right now.
Mm-hmm.
And I think of some of the issues I have, and there are enough of them. 6 or 7 minutes, I'm barely telling him what happened since I last saw him.
Sure.
And as I'm understanding direct primary care, that industry that's now starting up, maybe we could talk a little bit about that too, how that's happening on the seacoast as well as other parts of Maine. Mm-hmm. It's more of that one-on-one kind of family doctor relationship.
Absolutely. It's so, doctors, if you poll, just a bunch of primary care doctors, a lot of them are burnt out. A lot of them are not happy with the way things are going. And if you likewise poll their patients, they would say similar things. So, direct primary care is very refreshing for both parties because, it goes back to basics of, patients forming that relationship. There's continuity over time because, you put up your shingle, right. Here's my practice, and I'm here for the long haul. That's what I'm trying to get across
right.
to the community.
Now, how fast is, first of all, another thing in my research last night, although I kind of knew this, because it seems like every time I go down to Boston, I have a different doctor, and it's like, what happened to the other? Oh, he went off on his own or whatever. So there seems to be this turnaround now that's starting more and more, and I think it's probably doctors who disagree with the philosophy of in and out, check in and out, and are burnt out. Mm-hmm. So many of these doctors, and even chatting with my sister who works at a hospital in Boston, was telling me even some of like the heart surgeons she knows, they have become direct care as well, so they can spend more time with their patients. So there seems to be more and more doctors leaving what we have known as the medical industry and going more into their own private direct care. How is that business doing in the local seacoast area in Maine? Is it like, is your practice something that was the first here, or do we have others?
Mine was one of the first. It's certainly the first in York and the immediate local area, but we do have others in Maine, and we're actually a network of doctors in a sense. I mean, we share resources. We meet regularly. So we're not out there. We're not islands. We really have an interconnectedness and and a strong collegial relationship, which is something that's not seen too much nowadays. And in Maine, the current head count is, I believe, 9 doctors practicing DPC, direct primary care, which isn't a lot, but nationwide, we're up to about 600, and it continues to grow.
So what are your patients, for example, saying about the private care? Because I still get the impression from reading a lot about it that this reminds me of the good old days of the doctor coming to your house and paying attention. What are you hearing from patients? From reading last night that and you had mentioned it earlier, so insurance companies don't yet, at least at this point, pay for that. So what are you hearing from patients? Because that would mean a patient would have to pay a direct primary care out of pocket, so to speak, and I'm sure they want something back. What are you hearing about that?
Well, it's mixed. It kind of depends on where the patient's coming from. If they're coming from a situation where they don't have insurance, a lot of times they, to join I don't want to say a normal practice, but a practice, let's say a hospital-owned practice, and it's kind of they a lot of times are told they need health insurance, and so I do get people are very happy to find a doctor where they don't have to have health insurance. Now, I strongly recommend they have some kind of catastrophic insurance.
Right.
I think everybody should have that. And then you have patients who are on Medicare, and Medicare does provide a lot. But having health insurance is not having health care per se. Right. And so, don't get me wrong. It's sometimes a difficult sell, for lack of a better word, but once patients get into the practice and experience what they're not getting, it's the feedback is amazing.
Right, which is what I would expect. All right, I'm going to give you a break to an underwriting here. Maybe even play a song that has the word doctor in it.
All right.
Yeah. It's WSCA. It's the Scratchy 45s and Beyond show. We have Dr. Sacchetti from York, Maine, as our guest this morning. And it's another nice thing about having a community radio station. So we'll be back.
Programming on Portsmouth Community Radio is provided by you, our members, and by Timberland, with product designs inspired by a rich New England heritage and a commitment to the environment and the places we live. Timberland employees have volunteered over 1 million hours of service in communities worldwide. Further information about Timberland can be found online at timberland.com.
Now, for those of you who know me, there was no way I was not going to do something to tie him into music. How about the Thompson Twins and Dr. Doctor on WSCA, Scratchy 45s and Beyond, and then we'll be back. Chat a little bit more about direct primary care and what it's about and what it's not on the Scratchy 45s and Beyond show, WSCA. 106.1 FM, WSCA, Jackson Brown, Doctor My Eyes. Before that, the Thompson Twins, Dr. Doctor, and lo and behold, there's a doctor in the house here in the studios.
Here I am.
Here he is. And it's the Scratchy 45s and Beyond show. It's WSCA FM 106.1 and WSCAFM.org. And it's 11:27. We have 38 degrees. It's like wintertime. Is it just me, Doctor? Are you like wondering where spring is?
Of course.
It's like snow yesterday. It was coming down like a blizzard.
I know. It was terrible.
And then when my wife came home, she's like, it isn't even snow anymore. It's like all ice. It's like just sleeting out really heavy. It's like, I need sun.
Me too.
All right, we're talking about a direct primary care physician and some of the practices that are beginning to open up around this area. How many direct primary care physicians roughly are there in New England?
Oh, in New England? Well, I think we were just talking, and I mentioned that Massachusetts probably has the most. Last I heard, there were 20. Maine has 9. I think Vermont has a couple. Connecticut, there are a few. Rhode Island, a couple. So but it's growing. So it's really hard to give an exact count.
So has a network been formed yet, where you guys are kind of all, like an industry network yet?
Yes, actually, it's been in the works for over a year, and finally was formalized this year. We call ourselves the New England Direct Primary Care Alliance, and we really, our mission is to one of our goals is to recruit more physicians into direct primary care and help guide them and give them support.
I was reading yesterday when I was doing my research on there was a little story about somebody who was going to medical school, and he was writing about when he gets out of medical school, he would like to go into this form of practice because he felt it was more patient attentive, and it's why he's going to medical school. And he was really very pro of this. So it sounded like that, at least at some level, it's hitting the college environment that this practice exists.
He's very forward thinking. It's very unusual for a medical student to even have exposure to this. So either he knows a direct primary care doctor, or just fell upon it through reading. But it really is about preserving physician autonomy and preserving the doctor-patient relationship. Those are integral to medicine as we know it.
Right.
That's another goal of our group, and actually we've already started this, is reaching out to medical students and being active with having them shadow us in the office and going and having roundtable discussions.
Oh, cool.
And, yeah.
Now, how would so I want to talk a little bit about how this would work. So, someone comes to see you, and there's some going back and forth, but in the end of the day, if they were to sign up with a practice like yours, how is that working? Like, how are you billing them? How does the billing work? Is it per hour? Is it per visit? Is there a limit of how many hours? So I'd like to chat a little bit for those who haven't read like I've been reading. How does it work, and what services overall are being offered other than a doctor sees a patient for 20 minutes instead of 5 minutes or even an hour? What else is being offered?
Okay. Well, direct primary care has a certain set of criteria that, and when I tell you this will, you'll realize that it is different from concierge. One of those criteria is that there's a recurring periodic fee, and a lot of practices do monthly. I do quarterly. Second part of that definition is that we do not take payment from any third parties, which is really different from concierge, because a lot of concierge practices will take a retainer fee and then still bill the patient's insurance on top of that.
So you're totally removed from anyone else persuading you or pushing you into you spend too much time with a patient, which is really nice, because the insurance companies are totally out of it with at least a practice like yours.
Yeah, to a point. I mean, I can still run up against that bureaucratic quagmire when I'm trying to get a test, approved or a drug approved for my patient. But I'm not. There are all these hoops that most physicians have to jump through to get maximal reimbursement from their insurance company, and a lot of it is nonsensical. And I just hone in on the issues. What's important for my patient, not what's important for the insurance company. And there is a cost associated with contracting with a direct primary care physician, but oftentimes we can offset that cost in other ways, such as in Maine, for example, we can dispense medication, and I save patients quite a bit of money on medication.
Wow, and that is expensive.
Yes.
I was reading your brochure, and it mentioned something about fitness tests, and so it sounds to me that there's more going on than I have a cold, I come and see you, you get to know me, and then I'm out the door until the next time I'm sick. So you also can save us money by possibly medication, which is a nice thing. What about, I was reading something about that you're also involved with a fitness test partner. Was that another service that's part of this?
Well, yeah, I'm going to speak to that, your comment as a whole, because I think you brought up a couple of neat concepts. One being, that direct primary care physicians have, a lot of leeway to do things that, doctors who are, attached to the regular medical system don't. And one of those, for example, I do have a nutritionist and a personal trainer who they subcontract with me to provide services to some of my patients. There's another direct primary care physician I know in Falmouth who incorporates yoga. So when people join her practice, they actually are also getting free yoga classes if they want them.
Right.
Which is really neat. And, doctors talk a lot about prevention, but when do they have time to help the patients execute a plan for prevention? We do. We can, and we do. So, anyway, I had another comment, but I forgot.
Is that all part of what somebody might be signing up for, as well as seeing you?
Yes and no. I mean, patients can certainly get these services on their own if they want them, but I sort of make it easier for them and have a kind of a la carte menu, so to speak. And that brings up a really good point that I wish to talk to the listeners about, and that is price transparency. That is a huge advantage to being part of a direct primary care practice, because that's really key to what we do, is providing the patient with here's the service, here's the cost, and being upfront about it, and
full disclosure. Wow. in health.
Yeah.
In English too.
Amazing. Novel concept.
Wow.
And so direct primary care doctors can incorporate all sorts of services, and I do. I mean, besides what I just mentioned, I have kind of a menu of items, and if a patient needs, a minor surgery, I just say, okay, here it is, here, look right here, here's the cost. And of course that's above and beyond, the fee, the routine fee, because it requires,
it's additional resources,
skills, and resources.
Now, what happens if somebody wants to? So you have a patient, and they want to reach their direct primary care physician, but it's 9:00 at night.
Not a problem.
No,
I mean,
you mean they don't have to go to the ER? Just to say to the doctor, I have a cold?
Excuse me, my voice just hit a high pitch. I'm speaking for myself and most of the direct primary care doctors that I know intimately. We keep our cell phones on for our patients at all hours. That's something you're not going to find elsewhere.
Wait a minute. So patients will have your cell phone number?
Yes, sir.
Wow. My listeners don't even have mine.
I will tell you that I don't get too many of those, 1 a.m., 2 a.m. phone calls, because I am so accessible.
I was going to say, because you would see it coming for the most part.
Right. And patients, it's human nature, I think, to put things off. Maybe it'll get better. But, patients have that sort of access, that open access to me all the time. So instead of, calling me at 1 in the morning, I might get
Right.
the call at 8 or 9 p.m., which
Right.
is, that's okay. I mean, it's still okay if they call me early in the morning too. But I will tell you that those calls have been very, very few.
Now, I have to ask this question because I was relating this to the good old days. So somebody doesn't feel good at midnight, and I don't know, maybe they have a really bad headache, and they don't feel comfortable driving, but they're questioning what's going on with them. Would you go to their house as doctors used to do, or is that not part of it?
Again, I can't speak for all direct primary care doctors, but in my practice, I will make house calls within a reasonable distance. First I would obviously screen the phone call to see, what's the seriousness of this. And, if it's serious enough at midnight, it's just call the 911, get to the hospital. But I often make house calls, especially for my seniors who, maybe homebound or don't want to leave the house. And I don't mind. That's very fulfilling too. I've yet to get a doctor bag. I'm still carrying items in a box, a cardboard box. So
I give you an old
if any
shoe
listener
box.
wants to donate a doctor bag, that would be awesome.
That would be cool. So let's say somebody has a lot of medical issues, and therefore they have 3 or 4 specialists they work with, maybe 2 or 3 different hospitals. Being my own situation, I have come to learn I need to be my own advocate. So a person like that, would a direct, and I think primary care physicians used to do this, but they got away from it. Would a direct care physician kind of be the nucleus and kind of he or she is the main focus and then makes all the contacts with the specialist, et cetera? So some medical person is an advocate for their patient, which I believe outside of specialists, perhaps, we've gotten away from that.
Yeah, I think in theory, primary care doctors are supposed to be the quarterback, and but in practice, you don't always see that. And I think the machine of these very large practices kind of have taken over, and there's a lot of assumptions being made. The communication's happening not on a personal level, but through notes or
Right.
Phone calls from one staff person to another staff person. What's nice about direct primary care is that I can and often do reach out to the specialists on a personal level. And a lot of them are shocked by that. And actually they, doctors really enjoy speaking with other doctors and trying to sift through these, 10 pages of notes to find what's important, what's going on with the patient. The direct communication isn't always warranted, but it's very nice to have.
Right. A lot of businesses, I worked for a conglomerate for 30 years, so I saw my medical insurance go from free to ridiculous and saw my deductibles follow suit. Let's talk about a smaller company, though, especially when I think of like the Seacoast. You have all these small companies at Pease, et cetera. Why, maybe they are, you can answer this, why aren't they diving into this more? Because I would think if I had a small company, like 10, 13 people, and I could put a direct primary care physician in part of that solution, because I know you're only a part of the solution, and part of that solution, that would make my employees feel, wow, we have our own personal doctor. I would certainly know what my costs are up front, and maybe now I can eliminate buying some of the bureaucracy within my medical insurance policy for everybody.
Sure.
Is that something that you or the industry does as far as getting involved with companies?
We do. I think the reason a lot of small businesses aren't partnering with direct primary care practices has to do with a knowledge gap. I don't know that a lot of business owners realize that this exists.
See, aren't you glad you're here?
Yeah.
I got to pat myself in the back. And I really did.
But then it also comes down to, how many direct primary care doctors are there right now?
Right.
And so we're still a very small minority.
Right.
The other reason,
you would also have to limit yourself so that you're not overloaded with patients. If a company came to you with 1,000 people and said, I want you to take care of 1,000, obviously.
Yeah, I'd have to sign up a couple partners.
Right.
But no, we're talking, under 50 employee type businesses. And it has been done and will continue to happen. It's just getting the word out. But it's also, I think not everybody's comfortable with it yet. Mm-hmm. It's because it's new and, they may some business owners may look at it as being a risk they don't want to take on. But, the ones who have taken the plunge, are actually saving, and there's good data on this. They're actually saving somewhere between 10 to 30% on their healthcare costs for their employees.
Wow.
Yeah,
that's a lot of money, especially for a smaller company. Right. I know that because I know a lot of business owners and small business owners that fit in that kind of 25-ish employee count. They really were slammed with the rates over the last few years. Companies like I worked for, they're huge conglomerate, they have deep pockets, but these smaller companies, I would think it would make sense to look into a DP practice and say maybe this should be part of the formula.
Yeah.
What tied with that, my other question would be somewhat related more to the money side. This all sounds really, really good, and if I was on the other side of the speaker, I'd be saying this must be expensive because I have a 24-hour doctor, or at least I have access to a doctor should I need him 24 hours. It's going to help me with possibly medicine rather, and maybe even be an advocate for me. This would be something, at least this would be my thought, this would be something that's for rich people.
Yeah,
is there a kind of an industry price range or a price range, in this area of?
Yeah, I could sort of give an estimate, and again, I do, quarterly period. I have a quarterly periodic fee for my practice. A lot of practices, direct primary care practices have monthly. And usually, it's somewhere between, say, $50 to $100 a month, and which isn't unreasonable, But I think the trouble is that sometimes people are already paying so much for their premium, and they, it's just here's another cost on top of that. I think it's unfortunate that small businesses have been saddled with having to bear. Or their employees, really. It trickles down on the employees. But having these very high premiums and very high deductibles makes people not want to use their health insurance.
Right. It's 1147 WSCA Portsmouth Community Radio. We're talking with Dr. Sacchetti from York, Maine, about the kind of new industry, direct primary care physicians that are beginning to open up in various areas. What I'd like to do, where the clock's kind of moving on, Dr. Sacchetti, is how can listeners get more information about this level of care, number one, and then maybe you can give us some information if they wanted to contact you for information, either about your practice or about the industry itself, phone number, websites, that kind of stuff.
I have a website. It's www.ihealthyork.com. And this group of DPC doctors, of which I belong, is it's www.nedpca.com. And my practice phone number is 207-703-5365.
Cool. Want to give that number again?
207-703-5365.
And the website again?
It's I like as iPhone, ihealthyork.com.
Oh, pretty easy. Is that the name? That's the name of the...
my practice name is Independent Health Advantage.
Okay, so that's where that's coming from.
Yeah.
Cool. Easy.
But I abbreviated a little bit.
All right. In the few minutes we have left, Dr. Sacchetti, I'll throw it to you if there's any final words or thoughts that maybe I didn't ask that you want to get out there.
I'm enjoying practicing medicine. A lot of doctors can't say that nowadays. I really, it's fulfilling everything I'd hoped for when I went to medical school and did my residency.
Because you're kind of the age where you would know of how it used to be. Maybe you were too young to actually witness it, but you hear it.
I remember my mother taking out her checkbook at my doctor's appointments.
Yep.
Yeah.
So you remember that part. And
right.
You, of course, have seen that drastically disappear.
Sure.
I do have another question. What happens if you're on vacation or you're sick? I mean, does a patient then can't go to you, so they have to go back to go to an ER, or do you have somebody who would fill in for you? How does that work?
Well, I'm still sort of trying to figure that out. I've taken one extended weekend vacation, and I had another doctor cover for me.
Okay.
If I were to take, a longer vacation than that, I'm sure I would get some coverage. But the nice thing about direct primary care is that we have the freedom to use technology to our advantage.
Right.
And, we hear about telemedicine, and not a whole lot of people really know what that is. But, it's using real-time audio-visual to interact with a patient. And we're seeing a lag in that industry just because a lot of times there's no reimbursement for it. Right. So you're not seeing it happen really at the level of the hospital-owned practices. Right. But because patients are already paying me a fee, that's a service that I provide to them. So I have a virtual practice too. I mean, I can interact with somebody, from my cell phone, my other smart devices, wherever I am.
Technology, great.
Yes, great. If you can use it.
I'm actually very familiar with that. I had an appointment at Mass General, and the doctor said to me, rather than come all the way back from Maine, just kind of as a follow-up to see how you're doing, gave me a sheet of paper. He said, call up our number, an IT group, and they'll set you up with the virtual software, et cetera, et cetera. And it's free right now because insurance companies won't pay for it, but Mass General will absorb it. Mm-hmm. So when the time came, I did all the setting up, and of course, my luck. Oh, that expired with Mass General covering that. Oh. So I had to pay. It was $25, but still,
okay.
To me, it's all part of me. Is how much is my time worth? Mm. So I can pay the $25, which I did, and I got to see him.
Yeah, because that's less than parking.
Yeah, it was beautiful, and the time to drive to Mass General and curse at all Boston drivers because I was one of them. So, so this is like 2 years ago, and that was the problem. So here's Mass General, as we all know, is a great research hospital. Mm-hmm. We're really lucky to have them in our backyard. They're trying to make use of technology, which makes sense, which I don't know, how many people it takes at Mass General or other hospitals to use some common sense. Mm. But it's costing a lot more to get me to go down there, see 4 different people, and then see the doctor. There's so much overhead and tied with that.
Sure.
Rather than just absorb the $25 and put me in touch with the doctor. He spends 10 minutes with me, sees how I'm doing well, and we're done.
Yeah, right. I mean, and not every visit is conducive to, or not. Telemedicine isn't conducive to every visit.
Right.
It's really underutilized.
Yep.
And you're right. Who's making the decisions of these major institutions?
So I won't put you on the spot too much, but I am curious. Let's take a hospital, maybe a community hospital. I got to believe probably when it started up, it probably started up with a lot of medical people who felt, we need to grow this and grow it and grow it and grow it. I get the feeling in today's world, just by some of the things I see and hear, that more decisions at the top level are being made by MBAs, and not that I'm against MBAs, but you know what I mean.
Yeah,
They're being made by people like me who are business people, business backgrounds, and not medical. And I think that's okay at some level. Mm-hmm. But what I feel is that has triggered down now, right down to the doctor's office. I go in. Yesterday was a perfect environment. I go in to get an ultrasound, and the first thing is insurance. It's all about my. Mm-hmm. It's like don't even ask me what I'm there for.
Yeah.
Is you who have been in that environment? Is it my imagination, or is it those decisions seem to be more business people making them instead of medical.
You're not imagining it. We're at a real crossroads, I think, where medical ethics, is at risk for being displaced by business decisions.
Wow.
And I experienced that.
Yeah.
I did, and that was one thing that drove me to do what I did.
Well, because you have a doctor who comes up through the ethics of it's all about the patient.
Yeah.
And then here we are in the world we're in today. It's all about the almighty dollar, which is and there's a balance. It's like when I worked for a medical device company, and we were very highly regulated as well. But there's a balance with quality and cost.
Right.
You can't do everything for nothing, but you can't do everything short sticked either. You have to kind of balance that. It seems like we've lost that balance, where now, I clearly remember going into a doctor's office or a hospital and, hi, can I help you? Not literally yesterday. Before I sat down, it's, I'll need your insurance card and license. Okay.
Well,
hi, good morning.
I will say that there's not a whole, hospitals could take a couple notes from the service sector, the hospitality sector, because
that's a good point. Yeah.
My wife has been in hospitality for a long time, and I'm lucky to have her on my team. But it's so important.
It is. When I worked for Hewlett Packard back in the 80s, they would pull a certain amount of us and send us to Disney, not for the purpose of Disney for rides. That's kind of the aftermath, but to show what customer focus is all about, and how proactive Disney is. Mm-hmm. And
Sure.
HP believed in that. You had to have that culture within the HP, we should call it the HP way. Mm-hmm. If you didn't have that culture, that customer culture, you were gone. But they really would screen you before they even hired you because they wanted to see that.
Yeah.
So you're absolutely right. Let's send the hospital directors down to Disney to learn something.
Yeah.
All right, great. Well, thank you for coming in, Doctor.
Thank you so much.
And can we get your website again and phone number?
Sure. It's www.ihealthyork, I as in iPhone, iPad, .com, ihealthyork.com. Phone number 207-703-5365.
All right. Thanks for coming in. Maybe we'll see you again.
Thank you, Super Sport.
All right.
All right.
It's WSCA. It's 1156.